Hello everyone, it's Dr. Shalom Dam from Chem Health Diagnostic Center. Happy month of October. The month of October is a month when we look into breast cancer, we look into other types of cancers that have been ravaging the world and have been causing a lot of mortality and morbidity. Today, I would like to give my own voice in sharing and raising awareness on what these cancers do and how to prevent them. Let's start off with the meaning of cancer. Cancer is a type of growth that is uncontrolled and it cannot be stopped by the body on its own. And so just imagine that every cell, every tissue, it grows to a certain point, finishes its job, and dies. Then another cell replaces it. But when a person has cancer, it's not controlled. The body loses control of all these cells. So they continue to multiply and they lose out on their function. They do not behave like other cells should. They begin to occupy space. Then something happens. They break up from one location and spread to other locations. Sadly, breast cancer is one of the leading causes of deaths among all cancers, especially among the female population. Do male have cancers? Yes, they do, but not as many as females. So females have the most common and the males have very rare. So where are we going to with all of these talks? There's a lot of information you can find online about what the breast cancer is, but I want to focus more on the awareness part. Not every symptom that is going out there that everyone is complaining about is related to cancer. And there are some subtle signs, some subtle symptoms that some people experience. That is a pointer, but they do not know. And so they chug it up to, okay, it just happens every time in my period. I feel pain in my breasts and it goes. Or sometimes you say, okay, I felt that I had some kind of lump, but then after a while it stopped. And that's it. Not every lump is cancerous, but at the same time, it's something you want to check. Now, what are the risk factors for breast cancer? Number one, we say early menarche. What does that mean? It means someone who started experiencing her periods before the age of 12. But that is just a general statement. Different regions have different age criteria to determine what early menarche is. I've seen females start seeing their periods at the age of 9, 10. That's considered early menarche. Now, if you fall in that category, it does not mean you will have cancer. All right, it's just one of the risk factors that have been determined through research. The other thing is late menopause. Some people go all the way past their 50s, still seeing their periods, because the longer time there is an exposure to the hormone called estrogen, the higher the chances of course, in the presence of other factors, but higher the chances of those cells becoming hyperactive and going out of control. All right. The second thing is, now I'm talking about factors that are not modifiable. These are things that you cannot change. So as a female, you start seeing your period at the age of 9. You can't stop that. You can't stop that. You can't change that. Right? It's not your fault. But does that mean the all hell breaks loose on you? No, it doesn't mean that. But it's one of the factors. Now, what triggers other things is growing up in a family where there are cancers. So it doesn't always have to be a breast cancer, it could be an ovarian cancer. Different kinds of cancers could replicate, following with the genes and all of that, that a child will exposed to these genes. Now, let me just make a statement here. Because something runs in the family does not mean that every person will have the same condition. Every gene is just like sending artillery. It's like having a gun. But if you do not fire the gun, then that gun will not harm you. It doesn't cause any harm. Very interesting illustration. But that means someone could have a gene that if left dormant, if silent, the person will not have any symptom or suffer from that disease. Only if that gene is allowed to express itself. And that's when the person would have that particular condition. So we've talked about early menarche, late menopause. We've talked about family history. If someone has had cancer in the family, that increases the risk. Let me just jump from that and go into the modifiable. These are things that you can change, right? Number one, alcohol intake. A lot of people consume alcohol more these days as compared to what it was 20, 30, 40 years ago. This is increasing the chances of people suffering from different conditions, including breast cancer. Number two, smoking. Smoking of any kind, any sort. It changes. We call them carcinogens. These are substances when introduced into someone's body, it causes changes in the body, and the body begins to behave in a way it's not designed to. I will just pick a third one, which is exposure to chemicals. Now, different chemicals, I'm going to put all of them together. So, chemicals in food, chemicals in drugs, different kinds of medications. All these carcinogens are able to make the body behave in a way it's not supposed to. If you know that this is a risk factor, do everything that you can to avoid it. This is my fourth point, lifestyle. A lot of more people are living sedentary lifestyles and they have perfectly good excuses for that. I'll give you an example. Someone works remotely and has a 9 to 5 job. So you're working 9 to 5. After that, you switch. I'm talking about our people here in Nigeria. You have to work 2, 3 jobs to make a living. Now, you have a very good excuse to do that. But on the other hand, you are killing yourself slowly. And part of what's causing all these cancer issues to be more rampant and all of that is our lifestyle. Our lifestyle has greatly changed over the years. We're not moving around a lot. We're not exercising a lot. We're not resting. Exposing yourself to long periods of stress without rest is the problem. Stress is not the problem. It's the absence of rest. Your body's not able to recover, and the next day you're doing the same thing. So imagine you keep piling up amounts of stress over the years. That leads you to be vulnerable, and it allows all of these expressions of these genes to become very evident in a person's life. So I would also want to say that for those of us who have been wondering why and what we need to do, this is where the meat of what my discussion is. There are risk factors, there are symptoms, there is a lot of talk about all of this. But how can you get yourself to be protected, not just you, but also the next generation, your children? Is number one, you need to be aware of what these symptoms are. Now, if you're having breast lumps, you're having pain, you're having all of these, changes around the nipple, even some kind of swelling in the armpits, these are all signals. Please don't ignore them. Go and find out what they are. Don't rush to a pharmacy. I'm talking to my Nigerians. Don't rush to a pharmacy at the instance of every kind of pain or problem. Go to a doctor. Speak with a professional first. And let them tell you what you need to do. Change your diet. Work on eating natural, healthy foods. Avoid ultra processed foods. These things are changing every way that our body is behaving. And finally, do a test. There is a breast exam that you can do for yourself. You can do it. It's painless. It's not going to cost you anything. It's something you can do anytime, any day. Please check online. There are videos that teach you how to do a breast exam. Do that. You don't have to do it every day. You can do it once a month. But of course, you want to do it at specific times. We'll have a video to explain how to do a breast exam, but it's important for you to do that. And the second thing, you should make a regular habit of investigations. You can do scans, especially when you know you fall in the group of the risk factors. Please, you can do a breast scan, you can do a mammogram, you can speak with a professional. It's better for you to prevent what is preventable than to wait till it causes a problem before you try to find out. Because sadly, most people with breast cancer are getting help at the stage where they're already on. It's already bad. People get to look for help when it's stage 3, stage 4. And at that point, there's really not much that can be done. But if you know what to do it early. Thank you for listening. See you in the next video.